Welcome back to viewers. That was our stock market and financial report for here in the kingdom around the world, and hopefully everything will become very profitable, especially after we concluded half of the year. It's something I feel many companies are kind of checking what's been good, what's been bad, and what's profitable investment or options that they've really been working on, and they will go ahead and kind of see if they're going to have to mix it up. But the moment we'll be moving on to our next segment with our esteemed guest, Dr. عادل, who is an ENT specialist. We'll be discussing along the topic of tonsillitis. A little information about tonsillitis is something that I feel like is very important, and we'll be welcome here to Dr. Adil to a show to explain more. Assalamu alaikum. Good morning, doctor. How are you? So that's Dr. Adil al-Tahlawi, who is an ENT specialist. And doctor, today we'll be discussing about tonsillitis. We've heard a lot about it, but a lot of the dear viewers, they're not sure what it is. They know, they understand it, but they're not really concrete sure about what it is. Can you explain us to more the definition and causes of it?
Before defining tonsillitis, we have to define what are tonsils. Tonsils are two lymphoid masses, oval in shape, each on either side of the neck. Its function is filtration and production. Filtration of germs that could enter our airway. Okay. Production of antibodies that fight infection. Although tonsils fight infection, sometimes tonsils themselves could be infected, and the condition is called tonsillitis. Okay. Then what are causes of tonsillitis? Tonsillitis is mainly caused by viruses and rarely bacteria. The viruses that cause tonsillitis are the same viruses of common cold and flu, such as influenza, para-influenza viruses, adenoviruses, and herpes simplex viruses. Bacteria that cause tonsillitis, which is rare, are a group of bacteria called streptococci, hence the name strep tonsillitis, in relation to streptococci, the causative organism to tonsillitis.
Absolutely. Now, Dr. Adil, if we can move on and ask you about the symptoms and the signs of tonsillitis, how is it that a person can see some indications?
Yes. Symptoms of any disease, what is the patient's complaints? The patient of tonsillitis complains of fever, throat pain, ear pain, difficult to swallow, difficult breathing, and sometimes hoarseness of voice. Signs of tonsillitis, what the doctor see on examining the patient. On examining a patient of acute tonsillitis, the doctor could see enlargement and congestion of both tonsils. He also could see tender enlarged cervical lymph nodes on both sides of the neck. Sometimes a yellowish or whitish membrane covering the tonsil.
I see. And Dr. Adil, I believe there's bacterial and viral tonsillitis. Can you tell us what's the difference?
Yes.
And what the causes behind it?
Yes. We should differentiate if tonsillitis is viral or bacterial, because line of treatment will differ if it is viral or if it is bacterial. Differentiation depends on clinical examination and the laboratory investigation. Clinically, in bacterial tonsillitis, fever is of sudden onset. In viral tonsillitis, fever is gradual, insidious onset. Okay. In bacterial tonsillitis, enlarged tender cervical lymph nodes on both sides of the neck. In viral tonsillitis, this sign not found. In bacterial tonsillitis, there is tonsillar exudate, pus. When the doctor squeezes the tonsil by tongue depressor, tonsils oozing pus.
Oh, really?
In viral tonsillitis, the sign not found. Also, cough, Cough is present, cough not present in bacterial tonsillitis, but present in viral tonsillitis. When the doctor asks the patient of bacterial tonsillitis, do you have cough? The answer is no. But in viral tonsillitis, the answer is yes. That is clinically. Laboratory, how to differentiate bacterial and viral tonsillitis? Via a rapid and quick and simple test. It is called the rapid strep test. It takes only 5 minutes.
Okay.
Even the doctor can do in his office, in his clinic. By swabbing the back of the pharynx. It is called the throat swab. Then microscopically, the doctor examines the swab. If he could find any signs of bacterial infection, it is bacterial tonsillitis. If he cannot find, it is viral tonsillitis. We should understand how to differentiate between viral and bacterial tonsillitis. Even GB doctors should understand well how to differentiate between both, because lines of treatment differs exactly.
I see. And Dr. Adil, I believe tonsillitis is something that's mostly common in children. Is this something that's true or something that's not true?
Yes, most common in children. Tonsillitis is most common in children and rare in adults.
I see. So it's very few for adults,
Yes.
very rare for them to get
And
it.
as we will discuss after, complications arise in children.
I see.
Even if tonsillitis in adults, complications are very rare.
Indeed. And what's the differential diagnosis of a sore throat? Because the sore throat, I don't think it's like the same as tonsillitis.
It is a very important question. Many people think tonsillitis is the only cause of sore throat. But actually, there are many causes of sore throat. Not only tonsillitis. Tonsillitis is only one cause. We have to differentiate causes of sore throat. Sore throat is due to viral infections, viral causes, bacterial infections, other causes, neither viral nor bacterial infections. Viral causes of sore throat, viral tonsillitis, infectious mononucleosis, common cold, influenza, chickenpox, measles. All these are examples of viral diseases that could cause sore throat. Bacterial diseases that could cause sore throat, bacterial tonsillitis, whooping cough, which is a highly contagious upper respiratory tract disease and could cause sore throat. Diphtheria, which is a serious respiratory illness causing sore throat. Other causes, the most important, not viral nor bacterial infections, not infections such as allergic rhinitis. Allergic rhinitis, because of post-nasal drip, dripping to the back of the throat, it causes throat irritation and sore throat. Dryness, indoor air dryness, especially in winter, because of building heatings, it causes sore throat. Open mouth, what is called mouth breathing. In case of chronic nasal obstruction and congestion, it causes throat smoke.
It's very common, especially in the winter.
Yes. Smoking, alcoholics, spicy food intake.
Spicy food.
Yes, it is a very simple thing, but it could cause sore throat. GERD, which is gastroesophageal reflux disease, in which the acid content of the stomach is regurgitated upwards, maybe severe enough to cause sore throat. The problem is, many people complaining of sore throat, thinking it is tonsillitis. They come to our clinics, asking the doctor to prescribe antibiotic for them.
But
It is a misconception, should be corrected. Others go to governmental hospitals, asking for an appointment to do tonsillectomy, thinking it is tonsillitis. It is also a misconception, should be corrected. Tonsillitis is one cause of sore throat and not all causes. There are, as I mentioned, many other causes of sore throat.
And definitely Dr. Adil and our dear viewers, for at the moment we'll be getting more into this discussion, but for now we'll take in a short report and we'll be joined right after this. Stay tuned.
And well, with those very graphic visuals, we are back for just about anybody who is considering some problem in their throat. Please go up ahead and get it checked in order for you to not just keep on guessing as to what is the possible cause of your irritation or your problem. However, we're still in discussion with Dr. Adil al-Tahlawi, the ENT specialist with us. And now we're going to be asking you, doctor, about the treatment of tonsillitis.
Yes. Treatment of tonsillitis, 3 lines. Treatment of viral tonsillitis, 1 line. Treatment of bacterial tonsillitis, another different line. Surgical treatment, which is tonsillectomy, is a 3rd line. Treatment of viral tonsillitis, no antibiotic, just rest. Rest means body rest and the voice rest.
Voice rest.
Yes, it's very important, voice rest.
So the people that are very talkative, they can't talk.
Yes, don't talk.
See, write that down, Suleiman, write that down.
Plenty of fluid intake to keep throat moist, not dehydrated.
So drink lots of water.
Yes, salt water gargling.
Gargle.
Salt water gargling. Antibiotic, painkiller, no antibiotic. Treatment of bacterial tonsillitis, which is the most important, the main line is antibiotic.
Okay.
Antibiotic of choice in treating bacterial tonsillitis is penicillin. If the patient is sensitive to penicillin, any alternative antibiotic could be used. We have to concentrate. Treating bacterial tonsillitis via antibiotic should complete 10 days at least, even if symptoms go away earlier. If the patient gets improvement within 2 or 3 days, he should continue treatment by antibiotic for 10 days at least. Because if the patient in bacterial tonsillitis didn't take antibiotic at all, or take antibiotic but not complete 10 days, the patient, especially children, at risk of developing complications, such as the most common two complications of bacterial tonsillitis, rheumatic fever and post-streptococcal glomerulonephritis.
So it was definitely escalated.
Yes, rheumatic fever, which is an inflammatory disorder affecting our heart, joint, and other tissues. Post-streptococcal glomerulonephritis, which is an inflammatory disorder affecting our kidneys, making kidneys unable to remove waste products and the excess fluid from our body.
But also, Dr. Adil, one issue is I always wanted to ask an ENT specialist. You know, when people have to have their tonsils removed, is there a lot of procedures or precautions they can do to go ahead and receive treatment immediately, go to a doctor if they start feeling like sore throat or something like that? Because I feel like, is it true that if you wait too long, you will have to have your tonsils removed? Or is it just continuous complications, especially like in children?
Yes.
They continuous complications like this is not working, this is not working, this is the last result,
Yes.
last pretty much options they have is to remove the tonsils.
Yes. Then the third line of treatment, then I come back, which is tonsillectomy. Tonsillectomy is the removal of the tonsil. When indicated to remove the tonsil. Indications of removing the tonsil. First indication, recurrent tonsillar infection. It is said that more than 7 episodes of tonsillitis in 1 year, or
7 in 1 year.
yes, or more than 5 episodes of tonsillitis in the last 2 preceding years, or more than 3 episodes of tonsillitis in the last 3 frequent years is the first indication of tonsillectomy.
That means it's just going to be continuous.
Yes. Second indication, in cases of tonsillar enlargement, tonsillar hypertrophy, enlargement of the tonsil may be physiological, Allah creates like this, or maybe as a result of recurrent tonsillar infection. Enlargement of the tonsil will result in difficult to swallow, difficult breathing, and sleep apnea. The patient gets up with difficult breathing.
I see.
In all of these situations, tonsillectomy is indicated. Third indication, in case of tonsillar or peritonsillar abscess, abscess within the tonsil or abscess in the tissue around the tonsil, but not responding to any proper antibiotic, tonsillectomy is indicated. Last indication of tonsillectomy, in case of cancer tonsil, foreign body in the tonsil or bleeding tonsils, all these are lines, all these are indications of tonsillectomy along with lines of treatment of tonsillitis.
I see.
Indeed. Now, Dr. Adil, if we can ask you about tonsillitis, is it true that it can be hereditary, that it actually runs in the families, and how can we prevent it?
Yes. Tonsillitis is not hereditary. Many people think tonsillitis is hereditary. Tonsillitis is infection. People think tonsillitis is hereditary because maybe more than one child within the same family may have recurrent tonsillar infection. But it is not, or maybe more than one child within the same family have got tonsil removed. But it is not a proof to be hereditary. Why? If one family go to a hike in mountains and the whole family come back with muscle pain, is muscle pain hereditary? No. If I have one child of me have got his finger infected, another child of me have got his finger infected, is finger infection hereditary? No, it is infection. Tonsillitis is infection and not hereditary.
I see.
Then I move to how to prevent
Okay.
tonsillitis. Prevention of tonsillitis, hand washing, repeated hand washing using hand sanitizer.
Incentive.
Yes. Sneezing in tissue. If tissue not available, sneezing in your elbow. Don't sneeze in your hand.
So you'll be go ahead and
Yes.
shake someone else's hand.
And pass the bacteria all around.
You have tonsillitis, everyone else got it.
Yes. Avoid close contact with patient with upper respiratory tract infection. The distance should be at least 1 meter or more.
What if they have a huge lung and they can sneeze far?
Yeah.
You're in the other room and they got
Yes.
you.
Avoid sudden change from hot to cold atmosphere.
From hot to cold?
Yes.
This is a Riyadh.
If you are in a hot room, don't move outside directly. Gradually change from hot to cold atmosphere. At the end, stop smoking everywhere. Stop smoking everywhere.
That's definitely good advice. Definitely, thank you so much, Dr. Adil, because I feel like now I have good information to how to avoid people with tonsillitis. That means you gotta keep a distance. But any last word of advice you'd like to give, especially the parents, because I believe, you know, tonsillitis is mostly common in children. This is the biggest area where, you know, you as an ENT specialist, you see mostly children. Very rare adults because, you know, maybe bacteria or something like that. Any last word of advice you'd like to give our dear viewers at home?
Yes, my last word is avoid close contact with patient with upper respiratory tract infection as far as you can. Hand washing repeatedly using a hand sanitizer, and stop smoking everywhere. My last advice.
Indeed,
and
definitely.
thank you. I hope very healthy life to all people. And thank you.
Indeed, definitely. Thank you so much, Dr.
Thank
Adil,
you.
for joining us today. It was an absolute pleasure.
Yes.
And for our dear viewers, that was Dr. Adil al-Tahlawi, who is an ENT specialist. And we're discussing along the line of tonsillitis. You know, it's something that, unfortunately, anyone, you have a family member or a friends or family, someone that they really had tonsillitis. And of course, it's not something that really anyone wants to go through it. So it's definitely good insights into the world of tonsillitis, as I will say. At the moment, dear viewers, we'll be taking a quick break and be joined right after this. Stay tuned.